How are you? Today we need to have a serious conversation. We need to speak directly and clinically about the dangers of anal sex, or anal intercourse, however you prefer to term it. This is a video of extreme importance. We know that for many, this topic might bring a sense of embarrassment or hesitation to share, but for those with whom you have intimacy, or for anyone who values their health, this information is vital. We are approaching this subject strictly from a medical and scientific perspective. We specialize in the diseases and surgery of the intestine, rectum, and anus. The goal here is not to judge lifestyle choices, but to provide the medical facts necessary to prevent life-altering injuries. Before we dive into the details, if you find value in science-based health education, please subscribe to the channel and turn on notifications. This channel is built on scientific evidence, not guesswork. What you hear here is safe to follow. And please, take a moment to like this video. It helps the algorithm deliver this safety warning to more people who might need it. Let's get straight to the point. In recent weeks and months, there has been a significant increase in patients arriving at clinics and emergency rooms with severe problems. It does not matter if the patient is male or female. It does not matter if the sexual activity is heterosexual or homosexual. The anatomy is the same, and the injuries we are seeing are identical. We are talking about lesions of the anal sphincter. Regardless of your personal beliefs or anyone else's beliefs about whether this practice is right or wrong, the reality is that people are doing it. And many are doing it in a way that is causing severe physical trauma. We are seeing patients coming in with significant lacerations, cuts, and tears in the anal sphincter muscles. To understand why this is dangerous, you have to understand the anatomy. The anal sphincter isn't just one muscle. It is composed of two distinct parts, the external sphincter and the internal sphincter. These are located at the very end of the digestive tract. The external sphincter is the muscle you have voluntary control over. When you feel the urge to use the restroom but you are not in a convenient place, this is the muscle you squeeze to hold it in. However, the internal sphincter is different. It is involuntary. You cannot control it with your mind. It is almost always in a state of contraction. It is a very powerful muscle designed to keep the canal closed tight. It only relaxes naturally when you are actually in the process of defecating. Otherwise, it is clamped shut. This brings us to the first and most critical concept you must understand: the anus and the rectum function as a closed exit. This is fundamentally different from the vagina. The vagina is biologically designed as an entrance. It is an orifice that is semi-open, has elastic tissues designed to expand significantly, and most importantly, it produces its own natural lubrication. The anal canal is the opposite. The door is effectively locked. It is a closed high-pressure zone with no natural lubrication mechanisms. When you attempt penetration into an area that is designed to be closed and dry, without taking the proper medical precautions, you are risking a laceration. You are risking tearing both the external and the internal sphincter muscles. We are seeing cases of extensive lacerations that result in profuse bleeding, excruciating pain, and, in severe cases, fecal incontinence. That means losing the ability to control your bowel movements because the muscle has been torn. This often requires surgical intervention to fix, rather than just simple medical treatment. So, how do you prevent this danger? If you are going to engage in this activity, there are strict guidelines you must follow to protect the anatomy. The first rule is regarding lubrication. You absolutely must use a water-based intimate gel lubricant. This is non-negotiable. Recently, we have seen many patients suffering from lacerations because they used the wrong kind of lubricant. Do not use oil-based lubricants, silicone-based lubricants, coconut oil, lotions, or thick creams. Here is the medical reason why. If a fissure or a small cut occurs during the act, which is very common, an oil-based or silicone-based substance is highly viscous. It does not wash away easily. It can actually get trapped in the bed of the wound, inside the cut itself. When oil sits in a wound, it creates a barrier that prevents the tissue from healing. It complicates the recovery process significantly. What could have been a small tear that healed on its own becomes a chronic, non-healing wound that might require surgery. Furthermore, avoid lubricants that have numbing agents or anesthetics. Pain is your body's warning signal. If you numb the area, You bypass the body's alarm system, and you may continue to cause severe damage without realizing it until the anesthetic wears off and the damage is done. So, stick to water-based lubricants. And you cannot be stingy with it. You must lubricate the anus, and you must also lubricate the penetrating object or penis. Lubricating only one surface is not enough to reduce the friction to safe levels. And speaking of safety and performance, we must acknowledge that maintaining a strong, healthy erection is also crucial for preventing accidents during intimacy. If you are struggling to maintain firmness, or if you simply want to restore your youthful vitality without resorting to dangerous pills or injections, you need to see this. There is a powerful, 100% natural purple hardening tonic that you can make at home in just 7 seconds. It targets the root biological cause of dysfunction that most standard treatments ignore. Point your phone's camera at the QR code on the screen right now, or click the link I've pinned in the top comment below to watch a short video explaining exactly how this simple daily habit can revolutionize your sex life. Now, let's move on to the next major topic, which is rarely discussed but is common knowledge among specialists: positioning. This is where most people make the critical mistake that leads to injury. You must remember that the rectum is not a straight tube. The name rectum implies straight, but anatomically it is curved and angulated. It follows the curve of the sacrum, the bone at the base of your spine. If you initiate anal intercourse in the genitopectoral position, commonly known as doggy style, or on all fours, you are putting the anatomy at high risk. In this position, the angle of entry often forces the penetrating object to hit the posterior wall of the rectum directly. The sphincter is angled down, and the entry is angled up. This mismatch in geometry is a primary cause of tearing and lacerations. The safest position to initiate the act is the lateral decubitus position. This means lying on your side. You might know it as spooning. When lying on the side, the anatomy aligns more naturally. Furthermore, the direction of entry should not be straight up the spine. The angle of the anal canal actually points towards the navel or the belly button. Whether you are the active or passive partner, you must understand that the trajectory must follow the anatomical line towards the umbilicus, navel, of the person being penetrated. This avoids hitting the delicate walls of the rectum and tearing the sphincter. Once penetration has been safely established and the muscles have accommodated, positions can be changed. But the initiation, the moment of highest risk, should be done lying on the side to prevent trauma. There is one more technical detail that can save you from a trip to the operating room. As we mentioned, the internal sphincter is an involuntary muscle. It is tight and it stays tight. You cannot just will it to open. Before any penetration occurs, you must trigger a relaxation reflex. This is done through digital stimulation. Using a finger with plenty of water-based lubricant, gentle pressure should be applied to the anal verge. This is not about immediate entry. It is about manipulation. You need to gently massage or press the area for about 5 to 10 seconds. This manual stimulation sends a signal to the involuntary internal sphincter, triggering it to relax slightly. It tells the body to lower its defenses in that area. This brief period of dilation is crucial. It opens the closed door just enough to allow for safer entry. Skipping this step and forcing entry against a contracted internal sphincter is essentially asking for a laceration. We cannot stress enough that this is an issue of health and safety. The goal of this explanation is to prevent harm. We see too many patients arriving with bleeding, tears, and injuries that were entirely preventable. If you do experience pain, bleeding, or any loss of bowel control, do not ignore it out of embarrassment. You must see a specialist, a proctologist, or colorectal surgeon. These injuries can become chronic and debilitating if left untreated. An acute fissure is much easier to treat than a chronic one that has been irritated by oil-based lubricants and repeated trauma. To summarize the protocol for safety, first, acknowledge the anatomy. The anus is a closed, dry exit, not a lubricated entrance. Second, use only water-based lubricants. Avoid oils and silicones that can trap bacteria and prevent healing if a tear occurs. Lubricate both parties. Third, start in the lateral decubitus position, lying on your side. This aligns the anatomy and protects the rectal wall. Fourth, Respect the angle. Entry should be directed towards the navel. Fifth, perform manual stimulation for 5 to 10 seconds prior to penetration to relax the involuntary muscle. We know this is a sensitive topic, but silence leads to injury. Information is the best tool we have to protect our health. If you found this information useful, or if you know someone who might benefit from hearing this medical perspective, please share this video. Do not let embarrassment stop you from preventing a serious injury. Thank you for listening and stay safe.